All right. Good evening, everyone, and welcome to our 100th session here at Virtual Shadowing. My name is Kiana Hunt, and I'll be your host today. Today is a special session. It's our 100th session, as I stated before, and today we'll be going through some tips and tricks that you guys can use in your own medical school interviews. Today, we will have our few volunteer participants doing mock interviews, and they'll be critiqued as well. And this can help us with any future medical school interviews that you all may be having in the future. And our interviewers tonight will be Dr. Fowler and as well as Dr. Yoon. And next slide, please.
Oh, so sorry. That's me this time. I'm sorry, Kiana.
It's okay. And our wonderful working group includes Taylor, Elena, Aditya, Rohit, Cheyenne, Christina, myself, Ali, and Ashita, and as well as Dr. Fowler, Dr. Salazar, Dr. Reno, and Dr. Yoon. And the next slide. And then we have some wonderful upcoming sessions. Next week will be hematology and oncology. The following week will be palliative care. And then finally will be an artistic approach to medicine, June 7th. Next slide. And then as always, we'll have two Q&As, one in the middle and one at the very end of this presentation. So just make sure to add all of your questions in the chat, and one of our working group members will try to get to it as soon as possible. Dr. Fowler, did you have any words for us before we begin?
Yes, thank you, Kiana, and welcome to all of you. It's so good to have you here. This is a delight for us week after week to, share glimpses into the purpose, the training, the practice, and the challenges that you've seen now from almost 100 clinician practitioners from all over the country, and really from Toronto all over the world at Virtual Shadowing. It's an absolute delight. We cannot believe we've done 100 of these things. And so we've got quite a lot of information stored out there. We finally hit 64,000 of you that have signed up. We did that yesterday. We've had over 520,000 viewings of our lectures online, and we've generated over 250,000 certificates of attendance. I feel very sure that as shadowing opportunities go, they'll be looked at more and more as in person and online. So we will be here as Virtual Shadowing to be able to bring you week after week very interesting people that have had quite remarkable lives. In June, Dr. Dennis Burns will be joining us. He is a neuropathologist, the bane of the medical students at UT Southwestern for so many years. He just retired, actually. And he was the chair of the admissions committee on which I served for many years. So his insights will be absolutely remarkable. And so with that, Kiana, you want to introduce what we're doing?
Sure thing. So as I said before, we'll just be going over some tips and tricks as how you can ace those medical school interviews. I know it can be something that can be kind of nervous at first, but just know that these guys have been in the position before, and they're going to give us some wonderful tips tonight.
And Dr. Nguyen, are you with us? Are you on mute, Dr. Nguyen? Well, regardless, we'll go ahead and get started. Welcome, everybody. Tonight, we're going to talk about something special. Dr. Nguyen and I are on the admissions committee, have been together for a decade at UT Southwestern School of Medicine. And it's been very interesting to watch how medical school admission requirements have changed a bit over time. Basically, let's get everybody go on mute, please, that's not speaking. Basically, there are about a dozen things that you have to complete: your GPA, your MCAT, your application, obviously, the scores from school and all of the transcript that's there, your essays, what sort of external activities have you conducted, what healthcare activities, how much and what kind of shadowing have you done. But Ben, speak up whenever you're ready. I think that he would agree the fact that the medical school interviews, and we'll speak to medical schools tonight and interviews to a medical career generally, The interviews play a very, very important role, and we'll touch on that in the next little bit. Ben, speak up whenever you're ready. Basically, you are interviewing with a person who is a faculty member with a medical school university. These are very smart people who are academics, and folks, they're doing this job on their own time. They're not getting paid. And they are individuals who really are doing this to continue demand excellence in the education and clinical training of individuals who are accepted to that medical institution. But keep in mind, for medical school, you are interviewing for a $6 million job as a physician, $200,000 a year for 30 years, $300,000 a year for 20 years. It's a lot of money, somewhat less for PAs and NPs, but that is increasing over time and for other professionals. Now, point number one, you're going to be writing this resume and this application. Listen to me. You have got to know what is on your resume and your background. For example, if you put down a research project that you've done, you've got to be able to explain exactly what that was. If you're asked about it, you may or you may not be. If you put down a publication, you have to be able to explain what it was that was the subject that you investigated and what was the general outcome of what you published. Above all, you have to be and show that you are the professional. You are, at the time of your application, the professional that you are asking the medical school interviewers to allow into school. Ben, any comments? You there?
Yes, can you hear me now?
Yes, sir.
Okay, I'm sorry. I have so much problem with the my computer, so I'm using my phone. But you're absolutely right so far. The application is crucial. You need to spend time to get to know your application extremely well, because like this says, once you interview, you have a 50% chance at some institution of getting accepted. So you need to be able to present yourself well enough so that you will be the 50% to get the offer. So again, I think everything that Dr. Fowler's been saying is spot on. Take it away, Dr. Fowler.
Ben, that's a great point, and I would love to follow on to that to say, y'all keep in mind, like we're going to have this year at Southwestern 6,000 applications for 230 spots. That means that there are 30 or 40 people standing in line for each spot. It's very, very competitive. That's why it's so important, for example, that you not have a black mark on your application. Please do not get a DUI, because that will, driving under the influence, that will be a black mark. If your school does not allow beer cans in the dorm room, don't do it, because if you get caught, you'll have to explain it. And folks, there are 40 other people competing for that same spot. So if there's an issue in your life, identify it now, put it past, and move on to your professional career. Now, this is indeed the virtual era. Putting my EMS and emergency medicine hat on, this COVID epidemic may get worse. We have crossed 1 million deaths in America alone, and the number of people ill with COVID is increasing now week by week. Indeed, we are beginning to approach the level of the caseload that was present in the last case bump before the Omicron onslaught. So it's likely going to be virtual. You may not be traveling to their institution, and so many, and so you may not be absorbed into an encounter with their institutions. You may not be traveling. You have to optimize then how you come across on a computer screen to a stranger at a distance. The interviews, folks, I have to stress this. We really pay attention to the interviews. You're meeting a very well-educated, dedicated stranger who's going to ask you some general and some very pointed questions. And your responses and how you handle these questions, sometimes on the fly, something maybe you hadn't thought of, will make a difference on your ultimate outcome. And so, by the way, you have to do your homework about their institution prior to the meeting. You need to be, they may ask you, why do you want to come to their specific institution? And you have to be able to explain that. So be very clear. You have carefully thought out well in advance why you want to seek this healthcare educational experience. And folks, you have to be able to explain it. Why do you want to be a doctor or an NP or a PA? Now, next point, practice in advance. Write it down. Share it with your friends. The next thing is, what in your life has led you to this decision? What points in your background? I've had people say, I got a hangnail when I was 3, and I've wanted to be a doctor ever since. That's probably not very convincing on an application. Important, and we're going to talk to you about this some more. What are your plans going to be if you don't get into school this time? After all, you said you wanted to learn an applied science, to enter into a partnership for healthcare, to be able to better the human condition. Well, if you don't get in first time around, what are you going to do about that? Do you still want to learn the applied science to enter into a partnership to better the condition of health for others? But especially, you have to demonstrate that you are a committed professional, worthy of getting into school, and that you would have the answer to that question well thought out. Why do you want to do this? Ben, any thoughts about that? We've lost Ben, so
no,
there you are.
I'm sorry. Yeah. Okay. So again, you're spot on. You need to convince the person in front of you why is it that they should accept you as a candidate. Later on we'll go over some points and pointers about what you need to do to make your interview memorable. Now, again, I think like the statistics says that 25% of applicants will get an interview. This is their AAMC data. And of those 25% who do get an interview, 50%, half of them will get an offer. At UT Southwestern, I think it's like 35 to 40% in the past couple of years. So once you get your foot in the door, the interview is a chance for you to shine, because the interviewer can be your greatest advocate, or it could be the other way around. So we'll give you tips and hints later on about what you need to do to really knock that interview out of the park. And again, like Dr. Fowler says, a lot of applicants have to go to methods to apply the second or the third time. What we need to do is we need to find out, like, if you don't get into medical school the first time, I would say the best answer is I will find out what may cause me to not land that spot and work on that to fulfill my desire to be a servant leader or something along that line. So don't give up.
Yeah, something like I will identify what I think are the gaps. I may get advice from others. There were the gaps for my last attempt, and I will improve on those gaps so that I can be more successful next time. Something like that, Ben?
Absolutely. Again, this shows perseverance, which is an admirable trait.
Right. So now, many of you, if not most, are going to be in front of a computer, especially if COVID really, predictors from the federal government are that we may see another 100 million cases this year. And so this epidemic may really continue to place, quite a block on travel. And so you very likely will be at the computer. So we have several thoughts about how to prepare yourself. Get the computer settled on a firm surface. Now listen to me. Reboot your computer at least an hour before your interview. If anything, maybe a couple or 3 hours, so that the computer is up and running. Even my Mac, I noticed that the RAM of my Mac seems to get kind of clogged up, and certain programs seem to move slower. So make sure you clear the RAM on your computer with that. It'll manage the software better. Turn off everything else. Email, internet browsers, calendar programs. Go ahead and put those. You're not going to need those during the interview. Check your audio and your video on Zoom. And the way you get there is to go up to the upper left-hand corner and click on Preferences depending upon whether you're using a Windows or a Mac or maybe an iPad and so on. And then decide in advance about whether you'll wear headphones or iPhone type earplugs, or possibly the speaker of the computer itself. These are decisions that you really got to make. And the next thing is center your face in the camera. Center it in the computer screen so that your camera will pick you up right in the middle. And avoid, I hope if you can see my face and see what I'm doing, avoid contacting and kicking or moving the computer during the presentation. You don't want to do anything that might irritate the interviewer. Remember, these interviewers, people you're going to be talking to, will probably have had a long day at the hospital or at the clinic. And by the time they're interviewing you, they may have had a very long day. And so you don't want to do anything that annoys them or irritates them. The next thing is check your internet connection and consider having an alternative connection that you can quickly move to if necessary during the interview. And finally, conduct a preliminary check of your setup with a friend, test it, and make sure that it's running. Ben, what do you think about this slide? It's about the appearance, to think strategically about your choice of combing your hair. This is a very culturally sensitive era, so be something that's very natural for you in the area of the culture where you live. A shaved face or a groomed face, typical of what you would wear. And then makeup appropriate for what would be something that you would typically wear to a more formal type occasion. Ben, any comments about the appearance?
I think that it's always nicer to be conservative rather than, I mean, everyone wants to stand out, but you don't want to stand out the wrong way. Okay, so it's always better to be conservative, in my opinion. And I think based on my interaction with the medical school admission committee for the past 10 years, that seems to be the case.
Thank you, Ben. So now, again, about the computer, lightings and surroundings. Double check your image, surroundings, and lighting well prior to the interview. You want the interview focused on your face, not what is behind you. Avoid your face being shaded or blocked. Avoid backlighting, for example, your back against a window. Keep your background plain and simple. Trinkets on the shelves and excessive wall art could be distracting for the interviewer. And then finally, be mindful of appropriate backgrounds. For example, y'all don't show a toilet, probably not a good idea, but really just show a room that seems to be well kept and that will demonstrate your cognizance of the fact that you're demonstrating a background that you know will interview well. Now, can you spot the difference? Look at Adidia's face here. What is he doing? Somebody speak up, put it in chat. What is he doing? That guy looks familiar. Yeah, Didi, you ought to know. Notice that he's looking down a little bit. His eyes aren't straight at the screen. This is his eyes straight at the screen. Notice that the light is glaring off his glasses, and there's also a shadow in his background. These are all some things that are important to work on, especially though eye contact with a camera. Now, that doesn't come naturally to a lot of folks because your camera may be a little green dot that's up at the top of your screen. And actually looking at that green dot may not be natural at all for you, as opposed to looking at the center of the screen. It may be one day that laptop and computer technology will be such that the green dot is in the center of the screen since this world has grown so much virtually. Adidia also points out that he placed his laptop on a few textbooks to be able to get it up higher. Again, I would take note of that shadow in the background and see if that is something that you could work with. So about virtual eye contact and perspective, although unnatural, looking into the camera shows the interviewer that you are engaged and actively listening. When looking directly into the camera on the other end of the meeting, it will appear that you are looking into the eyes of your interviewer. You want to be eye level with the camera. Stacking books, as we mentioned, under your webcam can help raise the view to eye level. And ideally, your screen frame should include everything really from about shoulders and above. I strongly suggest that you dress conservatively from top to bottom. If you had to stand up all of a sudden, suddenly, you probably don't want to be in a swimsuit. That's just a thought, but it's something to think about. Now about the sound. This is something I really noticed. I do a ton of virtual meetings every day. I was on meetings for hours today. And keep sound distractions outside of the room. Children, pets, your cell phone, turn it off, and so forth. Confirm audio and mic settings to ensure that you are heard loud and clear. Let me talk about that point for a second. It's very often that people will tend to drop out. I'm going to demonstrate. They will tend to drop out and not heard very well. What I said was drop out and not heard very well. And so it's important that you be aware that you are positioned such that if you're using the microphone of the computer or if you're using a headset, that the microphone is picking up very clearly. I was in a meeting today with one of my dear friends out in Oregon who was wearing a headset with a mic who dropped out all of a sudden, even wearing a microphone. So you've got to check all these things. Again, very important that you reboot the computer a few hours before the session. Sit closely enough to the microphone to make sure that you're heard clearly without spotty interruptions or a low sound level. Remember that all of this is up to you to make these verifications in advance of the interview, or things may not go well. Ben, do you recall that from time to time, our really teched out students who apply to school a lot of times know more about Zoom than the interviewer? And Ben, don't you recall that we had many times that the interviewer will comment that something happened in the session and the student who was being interviewed was able to figure it out and fix it? You recall that? Ben, I've lost you. We'll move on to the next slide. Anyway, it helps sometimes that you may have some challenges that occur. Yeah, Ben, go ahead.
Technological stuff is going to happen, but the key thing is not to be flustered, to overcome. And also on the AAMC, we mentioned earlier about the interview day attire. On the AAMC, they say that the man should wear a two-piece suit. Always is the best and the safest choice. Conservative color and fabric. Everything should be clean, well pressed, carefully inspected. Ties, select a good quality silk tie. Avoid fashion extreme, like character ties. Interview, they don't like to wear a tie, and try not to wear a tie with a testicle on it. And facial hair, if you have it, it should be well groomed. And jewelry, they suggest maybe consider a conservative watch and remove any earrings. Again, all of this is available on the AAMC website. Thank you, Ray.
Thank you, Ben. Wonderful points. So how did the virtual interviews really go the last 2 years? The interviewers commented on the sound and video issues, which came up somewhat frequently. The interviewers commented that the interviewees were often able to solve the issues with the sound and video, that computer-savvy interviewees were appreciated, as I mentioned. Generally, there were little differences in the comments from the previous year by the interviewers as far as how the questioning of the interviews went. Everybody right now, take a long, deep breath. We're going to go back over number 3. Listen to me. Generally, there were very little differences in the comments from the interviewers from the last couple of years by the interviewers as far as how the questioning of the interviewees went. What I'm trying to get at is don't feel about the fact that you're doing virtual interviews that means that, in fact, you have less of a chance. That is not at all the case. Excuse me. My own opinion from all of we've had almost 2,000 interviews in the last 2 years, and that the virtual interviews seem to go very well, very comparable to what the in-person interviews went. And finally, the typical comments included nervousness of the candidates as well as use of the screen. That's two parts. In-person interviews often show someone who is quite nervous, who is, jiggling around in their seat, picking at their ear, pulling their nose, and rubbing their eyes, scratching their head, and just is acting a tad unprofessional. Not that it's bad, but it's not necessarily a $6 million candidate. And so work on it, practice it. And then please refer back to the issues about eye contact and screen use. For example, right now, I am looking directly at the camera on this iPad. Now I am looking over to the side of the screen at the slide, and you should be able to see the difference of eyes over to the slide versus eyes directly on you who is listening. So questions and answers. Let's start with a few questions along the way. Kiana, do you want to present any questions that have come up so far? Ben, are you right there?
Yes, I am.
All right. Kiana, do you have some questions for us?
Yes. All right. So my first question is, what is the best way to practice for the interview?
Ben, you want to take that?
Well, again, the best way to practice interview is just interview, practice. You need to find someone, preferably someone who is versed in the art of interviewing. And, I guarantee you can have 3 questions. Tell me about yourself. Why medicine? And if you don't, so those are the 2 questions that's guaranteed people will ask you. So you should have those written out. I mean, before you come in an interview, you should know already. And again, they don't want to hear about your GPA. They don't, they can read all of that. They want to hear something about you, something interesting. What is it about Kiana that make her stands out? Okay. So again, they want to, be conversational, be spontaneous. Again, be yourself, but be yourself, and then don't try to be too controversial. Just be likable. And you can do this by practicing, practice, and even practice more. And you don't have to practice with the same person. I would recommend practice with different people, because they each can have insights and feedback and suggestion for you.
Yeah, Ben, that's great. And I would add to that, set up a Zoom meeting yourself. Find a fellow professional school candidate in PPA, med school, and set up a Zoom meeting and record it, and ask your friend to write down 10 questions out of the blue. Don't tell them to you. And ask the questions to you as an interview and record it on Zoom. And then go back with your friend and watch, save it, obviously, and then watch that Zoom meeting together and critique yourself. Really treat it just like you would a regular interview, namely be dressed appropriately, have the room ready, and so forth, so you can see if any of the points that we are making here are relevant to that practice interview. Kiana, next question.
Yes, and this question has been asked multiple times. Do interviewers find it negative if candidates are too emotional, such as tearing up when talking about certain hardships?
That's a great question. Ben, I'll start on this one. To be turning 70 in November, I'm, as some of you saw in the Amazing Grace presentation, I'm a pretty emotional guy. And what makes me really emotional are the very moving stories that you find in medicine. I worked all weekend. I had several very moving cases. And so by and large, tearing up during a session probably would be a little bit of a negative. Is this person emotionally unstable? Is this a person who's going to be able to handle the tough rigor of an 8 to 12 hour shift in an emergency room, or 10 hours in an operating room? We deal with death all the time in medicine. And how will you be able to handle the grave illness and ultimately the death of patients and patients' family members that you serve? So what I would say to you is the fact that having to pause for a moment, is fully understandable. But breaking down and boohooing in front of the screen is probably a little much. Ben, how would you comment on that?
Yes and no. You're absolutely right. You definitely do not want to boohoo in front of the screen. Now, sometimes it all depends on the context of why the applicant is tearing up. If it's because of a personal experience and they just show some emotion, but then they were able to correct themselves and explain why that touched you so much and how you could go about and what you done to minimize having that occurring. I think that actually showed depth of character. I really do. I used to think of someone who's tearing up, bawling, I mean, who's tearing up as unfavorable because that means that they're not strong enough. However, with time, I think that seeing someone showing true emotion in the right context is, to me, is actually a strong point. And here's the other thing: read your interviewer. Before in the first, like, because you can judge a patient in the first 1/100th of a second by just looking at them. You should be able to have an idea of how your interview is going to be. For example, if your interview is going to be a pediatrician, they tend to be more giving, or a psychiatrist, as opposed to someone who is in a more uh, time demanding profession. That's just a generalization. But again, read your interviewers and respond appropriately. Again, I'm not asking you to be disingenuous. It's just that don't be afraid to show your emotion, as long as it's in the correct context, as long as it doesn't take away from the story.
Let me give you an example just to be on point for this, Kiana. I'm being interviewed, and the interviewer asked me, what was perhaps the most difficult moment in your life that you've come across relative to anything medical? And I would say, well, I can quickly say that watching my mother in ICU, suffering horribly from peritonitis, she was on respiratory support, she was suffering horribly, and then she looked my brother and me, my brother's an attorney, in the face, and she said, let me go. I'm sorry. Well, and we did. And we put her into a hospice where she slipped away over about a week. I apologize for being emotional, but you asked me the thing that was really the toughest in my life, and that was it. So the demonstration of that, and that was all very genuine, I am a softie, is that there are things in your life. They're going to be family things, your grandmother, your parents, your siblings, and so forth. And if you touch on those, it may cause an emotional moment. And have the moment, gather yourself, and move right along. Kiana, let's do one or two more.
Sure. Another question that I actually have as well is, in the past, it shows strongly that if you ask the interviewer a question, what are some good questions to ask? And how does it reflect on the candidate if they do not ask questions at the interview?
Ben, you want to take that one?
Sure.
Yeah, you take that.
All right. Whenever someone asks you, do you have any question about, definitely always have questions. Okay. You can ask things about the school curriculum. You can ask things about the support. You can ask, again, definitely have questions to ask them, because this will allow you to show them that, yes, you have done some background research on your school, meaning that you are really interested in the school. So again, always have questions, and the AAMC have a list of potential questions that is applicable. Let me take a look. But again, what I recommend is before you go to interview an institution, every place have a newsletter. Pick one up, read it, scan through it, and then that way you have ideas and topic to ask question. But always have question. But again, it has to be real, true question, not like question because you feel like you need to ask a question. Let me see. We can go ahead and move on to the next question, and I'll try to find some of the questions that are suggested by the AAMC.
Kiana, we'll take one more.
Sure. And this one kind of ties in. What is the best way to know a medical school? I know many other medical schools have mission statements, which is a great way, but should we focus on research as well?
I believe that if your path is taking you down a research pathway, that's sure. And you should be able to explain what your interest is. And if you've had research experience before, be able, as I said earlier, to describe exactly what you were working on. If there's a publication, know fully about what the publication was about. However, you don't have to have research. As far as an application goes, it's great to have some research on your application. Don't overblow that. If that was a project you did for a class that basically was completing a paper for class, that has quite a bit less overall emphasis than, say, working in a research lab, generating data, writing a scholarly publication, and being first, second, or third author. So I think it's important from your applications, as well as from the standpoint of the interview, to be able to explain what the research project was. But again, you don't have to have research on your application to be able to be a fine candidate and very competitive. Ben, did you have some points? Dr. Nguyen, did you have a point or two from the website?
Yes, can you hear me now?
Yes, there you are.
Okay, yes, okay. So like I have some questions, suggestions. For example, and you can ask them, are there any specific program for which your medical school is noted? Or you can ask like, what kind of, are there a mentor advisor system? Who are the advisor, faculty members, other students, or both? And you could, ask them like, how diversified is the student body? Are there support services or organization for ethnic minorities or women? And then you can, again, such as does this school provide guidance for students and its graduate alumni on the debt management? So there's also the question, really thoughtful questions that you can look up and have a list prepared for them. So I think that will shows that you have done research for the school to be able to come up with those questions for school specific. That is.
It'd be great if excuse me, if Aditya or one of the team could put that website location URL into the chat for the benefit of the students, Ben. All right, Kiana, I think we're going to move forward. So we're going to do our first interview with Ricardo. And Ricardo, are you with us? And I'm going to stop sharing for the moment.
Yes, I'm with you.
Oh, good. And Ben, I will do the first one. And Ben, notice that we've thrown in some extra questions from members of the team, which you can do or not do in your interview that comes up next. So Ricardo, how you doing?
I'm doing just fine. How about yourself?
Yeah. What brings you to our institution to interview?
Well, I've always been passionate about science, and then when I was a child, I didn't really have any particular inclination towards any STEM. And when I was 12 years old, I lost my cousin Laurita to a malignant glioblastoma, and eventually she passed away less than a year after this diagnosis. So then watching the progression of this disease really impacted me because I felt powerless. So then after that, I wanted to learn more about how I could prevent these kinds of things from happening. And I began to gravitate toward a career in medicine, bringing me here today.
That's a tough story, Ricardo. We've all had family and sibling issues that have been very humbling for us. I know certainly in medicine, as a doctor, I watched both of my parents slip away. It's very hard. Well, Ricardo, medicine's a tough business. Convince me you can make it in medical school.
Well,
I read your resume and I'm familiar.
Well, I believe I'm well suited to medical school because it's something I've always been passionate for. After I lost my cousin, I joined my high school's health magnet program, And there I was able to take health-related classes and shout out some physicians. And a common denominator that all these physicians told me for advice in my journey was that a career in medicine is a career as a lifelong student. And that kind of just pushed me further towards medicine. And when I was in my undergraduate degree, I learned kind of about academic research, which I hadn't been exposed to before. And that's something that I really wanted to integrate into my practice because I learned about being a physician scientist. And ultimately, I have this desire to influence medical science as a whole while being able to directly impact patient lives. And I believe that my experience, both in early childhood, going through high school, and my undergraduate with a biology major, music minor, and then my master's kind of gives me this different perspective from that kind of lets me view medicine in maybe different ways compared to other people. And
I noticed that your master's was in microbiology and immunology. Why did you choose those fields for a master's?
So I chose micro and immunology, particularly because I was interested in joining a certain lab. So during my master's, I worked in the lab of Dr. Mark Eppinger, who his research predominantly focused on genomics. And since it's a microbiology lab, I joined microbiology so I could be better suited for his lab. And I was interested in genomics because when I was taking the comparative genomics course from Mark Eppinger, I was kind of learning more about like next generation sequencing technologies. And I was really inspired kind of by where the technology was going. And I had kind of this vision of the future in medicine where these technologies would become commonplace in every practice. And I just kind of wanted to be part of that. So that's why I chose that major.
I noticed you, and this is actually something, I'm an emergency doc, and this is actually something we see quite often in the ER. You did phenotypic and transcriptomic analyses on enteropathogenic E. coli. What did y'all find in your work?
So that was my thesis project. My thesis project focused on, like you mentioned, enterohemorrhagic E. coli, or EHEC, of the serotype 0157H7, which is one of the most pathogenic serotypes of E. coli. And prior to this project, there had been some investigations on kind of what the main virulence factor of 0157H7 serotypes, which is the Shiga toxin. There were very few investigations that kind of saw what the Shiga toxin phage did aside from just producing Shiga toxin. And my project was the first project to kind of take a look at this from an RNA-seq perspective, fulfilling the transcriptomic part. And in this kind of study, what I found was that there was kind of global transcriptomic regulation outside of just the production of Shiga toxin. And the main pathways that we found were impacted were some anaerobic pathways, as well as the other main virulence factor of EHEC, which is the locus of enterocide effacement. We saw that there was a major downregulation of these genes whenever the Shiga toxin genes were being expressed under the late promoter.
I noticed you also did some work on something we don't see here in America much, but certainly it's a scourge worldwide, which is looking at the genomes and transcriptomes of Vibrio cholera. And you had a couple of papers on that. Any last comments on some of that work?
So that was an interesting study because what those works were surrounded around were Dr. Carl Close, someone who my lab was collaborating with at the time. He had identified this hypermotile strain of Vibrio cholera. So essentially, it was discovered when you plated on motility medium that it was much more motile. It basically spread further from the point of inoculation. And this was interesting because one aspect about Vibrio cholera is that pathogenicity is somewhat inversely correlated to motility. So then we wanted to see kind of what factors genomically were impacting or causing this hypermotility. And we kind of wanted to use this to kind of get better insights on the pathogenicity of Vibrio cholera.
All right, let's change tracks a little. That's very interesting. Let's change tracks a little bit. I noticed you graduated in December 21. What are you doing now?
So right now I'm working as a medical scribe. My official title is bilingual medical scribe. I work in a clinic that serves predominantly 65 and older Spanish-only speakers. And that's kind of what I do most of the time. Right now I'm working on my medical school applications, and also I recently got married to my longtime partner.
Well, good for you. So I'm going to just ask you this. What are you going to do if you don't get in?
Try again. And if I don't get in, next time I'm going to try again. But of course, that's going to come after reflection on what happened in my application cycle that led to my not getting in. So that's what I did last cycle. I applied last cycle and didn't get in. I had deep introspection on my application and kind of what I wanted in my goals in medicine. And I feel this cycle I've become a stronger applicant and a better person as a result of this introspection.
So that's great. We've got about 6-7 more minutes. Medicine today, especially my field of emergency medicine, has a vast problem with provider burnout. It's been estimated that as many as 20% of nurses are leaving the field. Physician burnout, it doesn't necessarily mean they're going to quit, but they're just so morally injured, so fatigued with their work. What's going to keep you from burning out, Ricardo?
Well, kind of handling stress, maintaining a work-life balance. This is something that I kind of had to deal with during my undergraduate, and I was able to scrape by. But when I got to my master's degree, it became something that I had to immediately address if I wanted to continue with my pathway. And again, I did introspection on how I could better manage my time, how I could relieve my stress. I make efforts to kind of maintain relationships and make time for myself and my family and my wife. And I also believe that my prior experience in a master's degree has kind of given me a better idea of what graduate level coursework entails and what the world of academic research entails. So I think that'll help me keep me from burning out.
In looking at your resume, I do have a question. Are you making time to play the trumpet?
I sure do. I practice regularly. I'm not in any groups right now because I only moved to Dickinson, Texas, this January, December-ish, after I graduated my master's. So I still practice, but I'm not in any groups right now. I've been playing for around 14 years since middle school.
And you're keeping your embouchure in shape?
I sure am. My embouchure, my aperture, my fingers, my muscle memories, all that good stuff.
Well, there you are. Well, we're going to begin to wrap up here in a minute. So what questions do you have, or questions do you have for me?
So you've touched on like kind of your motivations for choosing emergency medicine. And I was wondering kind of what other specialties you considered before you'd selected emergency medicine, and if there was ever any time where you felt like maybe emergency medicine wasn't for you and you considered a different specialty more.
That's a great question. And my pathway is one, as Stephen Jay Gould said, the tape of life, if rewound, would not play the same way a second time. And there were so many coincidences that occurred. I left the surgery program and started working ER full-time 44 years ago. And you know what? It just fit. And I found out that I had to study everything, every age group, every gender, in all languages. I had to interpret x-rays, read electrocardiograms, interpret laboratory work. And so I really grew up with it. And the way you know you're doing what you want to do, Ricardo, is you blink your eyes and 20 years pass. And that's what happened to me. In part, 2 years into my work, I went home. And for 20 years, I was hometown boy, come home. And so I've set up practice in my hometown. So I was blessed that I got into a field that the longer I did it, the more I liked it. That isn't the case for all docs or NPs or PAs. And so I think it would be important to realize the fact that if you find yourself in a field and at times you feel like this perhaps isn't the optimal target for you for your career, it's fine to change. But you have to do it thoughtfully. You'll probably borrow a lot of money along the way. You've got a family. And so you'll have to think about all those things as you go forward. We got time for one more question. I'm really enjoying this, by the way. You're a heck of a guy to talk to, even if you were an Aggie at one point.
Oh, thank you. Technically, I was a Dust Devil, though, because A&M International is not Aggies.
There you go. There you go. There you go.
So my other question is, what aspects of UT Southwestern do you think kind of set it apart from other Texas medical schools or medical schools in general?
Well, I came here in middle age, and I was 47 when I came here, and coming from private practice, and I've come here, there are two or three things that answer this for me. I've made the best friends of my life, Ricardo. I love almost all the people that I work with just greatly. So as far as a professional collegial interaction, I just love it. Secondly, the patient population in Parkland is very, very challenging. I could give you a dozen examples. I worked this weekend and I saw some really sick people near death. The third thing is I enjoy this institution very much. It is quite the academic institution. It's the third most quoted research institution in the world, and we've had 6 Nobel laureates. And I guess the fourth reason is that the faculty club, as Ben knows, turns into a bar at 2 o'clock, and you can sit there and have your drink and a Nobel laureate walks by. And you say to yourself, I am a redneck from the woods of Western Georgia. What am I doing here? And I guess one last thing I would say that it's so good to be a faculty member in a program that I could probably not possibly have gotten into as a student or a resident. But this is home now, and I love Texas, and I know you do too. Ricardo, thank you. What a great interview. It's a delight to meet you. I've really enjoyed reading your resume. You're quite the intellectual. And I deeply hope that your pathway finds it to UT Southwestern. So best of luck in your interviews.
Thank you. Thank you so much for your time. Thank you for allowing me to be here today.
Thank you. Thank you, Ricardo. All right, Kiana, take it away. Ben, are you there?
I am.
Okay. General responses. Oh, you were able to see it too, right?
That is correct.
Okay. So just off the cuff thoughts.
Yeah, I thought Ricardo did very well. So again, the story flows. I think that's exceptional. Again, it doesn't hurt to practice more. So I noticed, as time goes on, you did much, much better. But at the beginning, it didn't flow as well. But again, I think so if you could speed up the tape of your interview and start in your middle third, that would have been even better. And what this means is we just have to practice more, Ricardo. But the materials are there.
Yeah, Ricardo.
Thank you.
Ricardo, Ben and I have done hundreds of interviews, and I thought that one was great. You were a little hesitant at first, but then again, this was artificial. You're in front of 250 people, and it's a bit of a strange thing. You were looking down a little bit away from the camera, just to let you know. Your background was fine. You were dressed appropriately. I felt that your responses to the questions were quite thoughtful. By the way, let me apologize to Ali and Kiana and Cheyenne that I didn't pull your questions out. I'm sorry, I forgot. So all in all, I think that was really good. I think it warmed up as it went along. You showed a sense of humor along the way. It's important to be relaxed. And I thought that, by the way, that the questions you chose were good questions. They put me on the spot a little bit for me to explain why I got into the work that I do and why I'm at the institution that I am and so forth. Kiana, did we have any in chat? Any comments from the students?
I did not see any. Most was just giving praise to Ricardo, and you did do a wonderful job from what I saw as well.
Kiana, let me call on Ali, Cheyenne, and then you. Well, you already made your comments. So Ali, you've been through the interview process, and Cheyenne, you'll be next. Any comments? Ali, are you still with us? Ali's having a computer moment. Cheyenne, are you with us?
I am.
So your observations about the interview?
I thought Ricardo did a great job. Like you said, he's a very intellectual. He knows what he's talking about. Even though I personally didn't know anything about the research he was doing, it sounded like he knew very well what he was talking about. So that's important that you're not caught off guard on the research end of things. And I enjoyed, like you said as well, the humor, the sense of humor at the end, talking about the trumpets. I'm a fan of the more personal personal questions, what you do for fun, hobbies, things like that. So I always love hearing about those things. So you did a great job.
Wonderful.
Thank you.
Ali, did you show back up or no? Okay, he's in a coma somewhere. All right, we're going to move to our next interviewee. It'll be Miguel. And Ben, will you take it away? Miguel, are you ready?
Hello, I'm here.
Okay,
And Ben, are you all set?
I am ready. Uh-huh.
All
All
right.
right, Miguel. All right, you ready? Okay, so tell me about yourself, Miguel.
Hi, Dr. Wen. Nice to meet you. I'm from Texas. I went into college to really explore my options in higher education. I really didn't know what I wanted to get into, but I quickly found my way in the laboratory of Dr. Daniel Provenzano, where I did research on Vibrio cholera. Now, at that time, I was also interested in the medical school track, so I wasn't sure if I wanted to devote my time into studying for medical school or applying myself towards graduate school. And it was during this time that Dr. Provenzano said, you can do research and help vastly more people than by tending to one person at a time. And it was that understanding and just really understanding that the laboratory was a playground that really inspired me to pursue graduate school. So I went to Texas A&M to pursue my PhD in genetics. And it was during this time that I worked on phage. And during working on phage, I am next to what's called the Center for Phage Technology, where we work with clinical patients. And what's interesting is we can get these contracts to treat patients through the emergency care use. And so I asked one of these technicians how the project was going because they were purifying phage to treat a dying patient. And they looked down and said the patient died. And I was shocked. I couldn't really wrap my head around the idea that one of my favorite model organisms, phage, failed us in a way. The pipeline for getting the bacterial strain and then purifying the phage was just taking way too long. So it was during that time that I realized that I think my efforts are best put towards medical school. And so that's what got me into the medical school track.
Wow, you seem to have a lot of interest in the basic science. What do you think the purpose of medical school should be?
I think the purpose of medical school is to train physicians to understand the context of an ill patient. And so that's at least what medical school should be. And then residency helps the individual physician hone their skills on a specific subset of that practice. So medical school gives a generalized understanding of human anatomy, of illness, of markers and experience onto how to understand the patient's needs when they come into the clinic or when they come to the ER. I think that's what the use of medical school is.
So how do you feel UT Southwestern will be able to meet your goals and aspirations?
I think UT Southwestern has a competitive curriculum, and their experience in research can also impart my own curiosity can also impart experience into my own curiosity, because I do still appreciate research. I don't want to leave it all for good. So I think that combined with each other will help me be a thriving physician.
Okay, wonderful. Now remind me, where are you from, Miguel?
I'm from Texas. I'm specifically from a city called Los Fresnos, which is close to a city called South Padre Island. So it's at the southern tip of Texas.
Okay, wonderful. So tell me about your experience in working with diverse populations.
So I went to University of Texas, Brownsville, where we saw a lot of minority, which in that case would be actually the majority. And what I understood is that there are questions that you would normally need to ask people who are educated straight forwardly. You need to ask questions a different way to them. Not necessarily dumb down the question, but I've seen even people in my own institution just ask the same question over and over again to people who are really not understanding the question at all. They just don't have the knowledge base. They don't have the verbal skills to understand what it is a person's trying to ask them. So I think really engaging with these people, I understand that they're very emotionally expressive, so you can tell by their face if they're confused. No remarking on your question or on your statements is sometimes a bad thing. Some people think that if they're not asking anything, they understand everything fully. But from what I've understood is that if they're not asking anything, more often than not, they're confused. And they've been confused way before your fourth or fifth sentence into it. So you need to reiterate what it is that you're talking about, say it a different way, and actually see their body language, see them starting to agree with you, and see that their body language is that of an understanding nature, and not just tell them what you need to tell them for the sake of it.
So your family, are you the first one in your family to be in college? What kind of guidance did you receive in college?
So my mom did get a master's degree in I believe, Spanish, and my father had very little, if any, college education. My only mentorship in college was through Dr. Provenzano. Other than that, I had nobody to defer to in how to work my way through an undergraduate curriculum. What is the end goal other than a degree? What are my options post-graduating? So I was very fortunate to be mentored by him.
Okay, so from your understanding of medical school, what part of medical school do you feel would be the most challenging or difficult for you?
I think the most challenging and difficult for me would be anatomy and physiology, because it involves a lot of memorization. And with that said, I like to think deeply a lot about things. I like to know why things are a certain way, why they're called a certain thing. So I think putting that to the side might take me some time, but once I do, I'll be readily available to memorize these things in a quick and assertive way to apply them in a clinical setting. I think that would be the challenging thing for me.
Okay, good. Now, show me an example when you demonstrate initiative.
Okay, so it was actually very hard for me, but I started my graduate program in a lab where we study tetrahymena. And I learned early on that the principal investigator rather, was stuck in his old ways and did not want to embark on new technology. So I had to buy the reagents for this new experiment, work on it myself while doing his out-of-date methodology, and show him in parallel how the up-to-date methodology will address the question better than his out-to-date methodology. And frankly, he didn't like that at all. And I did realize that it was going to stunt my development as a graduate student. So I needed to take the further step into actually leaving his lab. So I think that was an initiative that I needed to, and it took a lot out of me. I remember even crying the second I told him I was leaving. I considered myself trespassing in the lab, and I needed to get out of there immediately. It was very emotional for me at that time.
Great. So tell me about a time that you have failed.
The time that I have failed. I think one of the times that I have failed is actually in graduate school. I was working on one of these earlier projects and I couldn't get the experimental method to work. I had tried again and again to purify this protein. And no matter what I tried to do, this protein just wouldn't purify. And I just tried different methodologies and nothing worked. And you just need to throw up your hands and say, for whatever reason, this protein doesn't like to be purified. And that does happen. Some proteins need to be purified in complex. You need to know what else needs to be called purified. And it being in a basic science laboratory, it's very hard to understand that when there's no other knowledge base for this protein. So that was something I failed in, but I had to put it behind me and move on.
Okay. How would your teammate or your lab mate describe you?
I think they would describe me as serious, punctual, and knowledgeable. I think that's how they would describe me.
Okay. What about your professor? How would they describe you?
I think they would describe me as honest, and I'm able to, I do what I say I'm going to do. So I am able to give them an answer and they can follow up that answer and it actually is the truth. I'm very forward. I think that's how something else would describe me, honest and forward. And I think those are the ways that they'll describe me, and hardworking as well. I've been told that.
Okay. What do you think about euthanasia?
I think it's interesting. I know some countries do allow it to occur. I think it needs to be evaluated on a case-by-case basis, and it needs to be understood very early on in a person's life that it is an option, and it needs to be brought up to that person, I would say, well before an illness even sets in. So I think it is a good tool to ease suffering and to lessen suffering, because not only is a person who is ill suffering, but it also does affect the family. And a person may not be able to get a job because they need to care for this individual, and that may set them back in their education, in their career. I've seen that happen quite a few times. So I think it is useful, but it warrants a conversation at large, in my opinion.
Okay. All right. Should drug addicts or someone who is socially disadvantaged with poor social support be a candidate for organ transplant?
A drug addict, I would say, considering their use of drugs, it would disqualify them, because you want to give this to someone who isn't going to damage something that's, in other words, a second life. So I would say it is disqualifying for that individual, in my opinion. I would want to look up to it further to see what it is in the general consensus.
Okay. All right. So if there's one thing that you want me to tell the admission committee today, what would that be?
It's interesting, kind of writing you a blank check. Frankly, I would want you to tell them the truth of what you found about me, what it is that you saw me as a candidate, what you saw my strengths to be in this interview, what you saw my willingness to succeed in medical school and to be a competent physician who can impact lives at large. If my interview can speak truth to that, I would appreciate if you could forward that to the committee.
Great. One last question. If you could be a flower, what would you be?
Ooh, a flower, what would I could be? I don't know if this constitutes as a flower, but I like to be a dandelion, because the gust of wind can take their seeds onto vastly different areas. And I like that idea of having a knowledge base that could impact vastly different and broad strokes of society. And I think being a physician can do just that. You're not only affecting the patient, you're affecting the family, you're affecting the friends. And if this person is a member of the community at large, you're really having a huge impact on the community.
Great. Do you have any questions for me?
My question is, how does the medical school program, in your opinion, enable the medical school graduates to be competent residents, even competent physicians, that sets your school apart from other schools?
Right. Well, I can't speak for most school, but I can speak for what we at UT Southwestern do. I feel that we provide, every medical school is going to provide you with fabulous opportunities. Now, there are no such thing as a bad medical school. There is such a thing as a bad medical school for you. You have to be the right fit. Likewise, the school have to fit you. So every medical school will provide you with the tools that need to be successful. Whether you're successful or not is going to be a combination of you finding the right fit, and more importantly, if the school is what you need to be. So it's a two-way street. It's not just exclusive. It has to be both person working toward the same goal. Perfect. All right, so that was great. So I think you did fantastic. Let me go over some of the suggestion of stuff that I noticed, okay? So like we mentioned before, everyone will ask you, tell me about yourself. And I thought you did a fabulous job. At the beginning, you were focusing a lot more on your scientific background, which is great, which is fabulous. I think is strong, but maybe you want to tweak that a little bit, just in case. Let's say if you talk to a clinician or an interview who are not clinical, so they may get lost in all of the science. But I think it's beautiful, but just try to truncate it a little bit more. And then they're going to ask you, so why are you interested in UT Southwestern? I thought you did a great job on that. So again, the key thing is before every medical school, read about them to find out how you can contribute to their mission. And then, the reason I asked you about the diverse population and stuff like that, because I know it's your last name, and I work with a lot of URM, underrepresented minority. So for those of you who are URM or who work with them, make sure you weave that into your interview. Okay, you notice I was kind of guide you along to see whether you were first generation or not, because that is important. I myself is a first gen, but when I was going to medical school, I thought that was a disadvantage. I didn't want to reveal that because I thought that would somehow make me, quote, less worthy to my other people, but that's not the case anymore. So that should actually be to your advantage. So if you happen to be a first gen, mention that, weave it into your conversation, and mention how challenging it is, and like you mentioned, and more importantly, how you're able to overcome those challenges, and how you're going to be able to add to treat patients of similar backgrounds. So I think that's beautiful. And then the other thing is like they're going to ask you to show initiative, which I thought you did a very nice job on that. And then when I was asking you about what your teammate would, this was the natural, because you were talking about your lab, the most difficult situation, the situation where you have failed. Now remember, all of us have failed. All of us, I guarantee you. So I think I like it that the fact that when I asked you, you took a minute to think, which kind of suggests you tell me that, oh, maybe he's not rehearsed. You see what I'm saying? So even if you know the answer, just reflect, just think about what you're going to present. So I thought that was good. So that's why when you talk about that situation where you didn't do in the lab, the important thing is you have to tell them, like, you need to identify why you failed and what you have learned from that. Okay, I think that could have been used. You could have added that a little bit more to your end, like what did you learn from that experience? And then the other thing is, so I thought you did very well. Again, some of the other questions, like I didn't ask you, like what would you do if you didn't get into medical school, but you kind of covered this at the beginning already, so that was great. And then don't be surprised if they ask you, out of the wall questions, like what kind of flower would you be? I thought your answer about being a is it dandelion or something?
Dandelion, yeah.
Dandelion.
That was,
Thank you. Yes.
that was great.
Yeah, I thought that was fantastic. So again, you want to be distinctive, you want to be memorable, and I think you have achieved that. So I think that's great. And the other question, suggestion, is just to how to streamline the process. And again, you practice, you're gonna do a fantastic job.
Ben, let me comment. Miguel, nice job. There was one thing you said that I want to caution you about, which is you said that your professor in the lab was, quote, stuck in the past, end quote, out of date, end quote, and stunting my development, end quote. I'd like to hear from Ben. I wouldn't say that. You don't want to be critical. You don't want to be critical. So that kind of comment likely will not settle well, because it sounds that you're being judgmental, resentful, perhaps even a little angry about it. Regardless
especially
of the fact
I'm sorry, especially if your interviewer happened to work in the lab.
Yeah, regardless of the fact it's all true. I mean, we've all been there in situations that things were not optimal. So I would write down a different response for that, something to the effect of, I found that my research techniques were really not all that compatible with the overall operation of the lab. And so I decided to move to a different location, something like that. Ben, any comments?
Yeah, I think that's a fantastic suggestion. And then the other thing we talk about, like the drug addict and organ transplantation, a lot of these questions, Miguel, will not have a correct answer, but they do have incorrect answer, if you know where I'm coming from. Okay. So a lot of these questions, they just want to see how you think. Okay. So again, try to avoid making comment that can be misconstrued, would be my suggestion. Any suggestion, Dr. Fowler?
Yeah, I thought you handled it fine. I share your belief. Someone who is just destroying themselves with alcohol and drugs and they need a liver transplant versus someone who's never touched a drop. There is one liver to go around, and you have one person that it's relatively predictive that this person may not be able to care for that transplanted organ versus the other candidate. There's so many judgments like this that we have to make in medicine. But I think it's always important to kind of soften it. And I thought you did fine, to say something to the effect of, we would have to weigh the situation of the potential candidates, especially if the organs were in short supply, so that we can make this transplanted organ, this gift, be something that improves the condition of humanity overall. That's a little vague, but at least it's pretty positive. Right. Kiana, go ahead, Ben. Ben, please.
Yeah, and again, mention that this is your view. However, and something such as organ transplantation need to be a group decision. There's always the organ transplants committee that will discuss this. So again, you say, this is my personal opinion based on my experience. However, I have to be respectful that this is not a decision rests solely with me, but it needs a collaboration or discussion with other entities.
Excellent. Kiana, do we have 2 or 3 questions that were from the chat?
From the chat, we didn't really have more questions, just kind of the same thing as just telling Miguel what a great job that he's done. But just one thing I want you to be mindful, Miguel, is just make sure to looking away from the camera and then looking upward in the corner as well. Just try to stay looking at the camera front on.
Thank you.
Yeah, that was a great job, Miguel. Any feedback from the working group?
I did want to add something. So I thought Miguel did a great job with the posture and most of the time, like the eye contact, in my opinion, was great. I think that you kept a really good pace of conversation as well. So you weren't missing any beats there. And your answers were very confident. I think that's important as well with the body language. I do think, and to echo what Dr. Fowler was saying about the ethical dilemmas, like the organ transplant, I think it's good to treat it like, if you're familiar with Casper, I'm sure that many students here are going to be taking the Casper exam. And those sort of questions, like what Dr. Fowler was saying about softening your approach, is to consider both sides and then being firm in your decision. So maybe before saying directly that, no, I don't think that a drug addict should receive an organ, you could say, well, maybe perhaps if this drug addict was willing to partake in some sort of drug addiction support program or something, and considering all other factors equally as other patients as far as comorbidities and things of that nature, and the potential for benefit to receiving this organ. Maybe that's something to consider as well in a group setting. So that's just kind of an example. But you did great, and I think you'll do great in the medical school interview. So thanks for being
excuse me, anything else from the working group?
One more thing, you did a really good job with the conversation. That was great. One thing I noticed is that there's a little bit of glare on your glasses. So just fix that for the actual interview and you should be good to go.
All righty, let's move to the third and final. Amelia, are you out there?
Hi.
Well, there you are. And I'm going to ask Ali and Kiana and Cheyenne to stand by. Cheyenne, please send a note to Ali and make sure he's with us. Well, hi, I'm Ray Fowler. I'm an emergency doc here at UT Southwestern. I work out of Parkland ER, and the busiest ER in the United States. We saw 1,000 patients in our 3 ERs yesterday. It was horrible.
Oh my God.
Yeah.
Yeah.
Busy. So where are you from?
So I'm kind of from all over the place. I am, I guess, living in Dallas now, but I grew up in a military family. I sometimes mention that I lived in 11 different places before I turned 18, like 11 separate moves. So kind of a nomad by nature, but born in Texas and now living in Texas.
So why medicine? Are you crazy? I mean, why in the world do you want to take care of sick people who are often in bad shape and bad moods and ill-tempered and often ungrateful? I mean, what led you to this decision? Well,
so initially I didn't know that I wanted to go into medicine. I'm a non-trad student, as they call them. I decided about mid-college that I wanted to go into medicine after starting to volunteer at a hospice nearby. I had wanted to get into volunteering in the local area of my undergrad school. And once I was there and I started working with patients who had also, so it was a veterans hospice and nursing home. And after working with patients who I kind of had a similar, past with, we both had the military in common. I was like, I want to get more into medicine. This is actually really interesting. So I ended up taking up a UT Southwestern summer internship. And that is kind of what sparked my true passion of like, this is what I want to do. This is super exciting. So,
what are you doing in your internship right now?
Also, I was an intern over the summer of 2018. And when I was there, I was doing research in the dermatology clinic. I was working with patients who were receiving Mohs micrographic surgery, which is essentially skin cancer surgery. It's a technique wherein, say, a patient has skin cancer on their face. They don't know how deep it goes. So essentially you want to excise the area and, send it to the lab, get it checked out, see if you have to go deeper. And so the doctor I was working with was really interested in addressing patient anxiety. You're sitting in a waiting room and you've got bandages all over your face because you just got a bunch of skin cancer taken out and you're waiting on the news of if they have to go deeper and get more skin cancer out. And so in 2018, it was kind of like, the big, I don't know if you know about like adult coloring books as a thing, but it was a little bit of a craze over that summer. And the doctor I worked with thought that it would be a good idea to try it out while I was there and see if patients liked using these adult coloring books and if it was a good way to reduce anxiety. So I was in charge of administering surveys and having patients use the coloring books while they were in the waiting room and basically see if it helped them while they were waiting to hear good or bad news.
So what would you say, based upon your experience thus far in medicine, Amelia, what would you say is the biggest need in medicine in this country today?
Oh, well, so I've seen a lot of underrepresented populations. I worked as a nursing assistant in a like small coastal town in Eastern Massachusetts, kind of during the middle of COVID. And we had a lot of homeless people come into our ER and then up to my floor. I was on a med surg unit. And a lot of times they just needed a place to stay. And we were kind of, going in and out of having open beds. And, we would often admit patients when it was the middle of a snowstorm and we couldn't really put them back out. Eastern Massachusetts is a little notorious for having an opioid crisis, especially in the winter. So seeing this very specific at-risk population and seeing their need for treatment and also their need, not necessarily for medical treatment, but just for a support system, I thought was so crucial. I mean, medicine to me is not just, you go to the doctor, you go to the hospital for whatever you need. It's also just your daily well-being and checking in on yourself and kind of navigating life as a healthy individual and whatever that means to you. So addressing the gaps in the United States of the at-risk populations is, I think, super crucial. I mean, not only to the well-being of the individual, but kind of our well-being as a country, as families, as communities.
I had a resident interviewee asked me, she clearly didn't want to come to our program, so she was kind of making the rounds, that work. And she said, "What are the two things you would fix at Parkland?" For the listeners, Parkland is the busiest emergency department in the United States. I'll tell you exactly what I would fix. That everybody could get the prescriptions that they need and they would get a guaranteed appointment. Here is your appointment for follow-up. No questions asked. Changing tracks a little bit, Amelia, for what you feel comfortable talking about, what's been some of the most difficult time in your life?
So there was, I guess, the time that I was in middle school, my mom was diagnosed with cancer. She had stage 4 metastatic breast cancer. And at the time, I had no idea what that meant. And she was young. She was only 38. And so knowing that she had breast cancer, I knew, there's something wrong. She's going to need treatment. Her hair is going to fall out. But I didn't know the implications of what it meant for her, up until now. Thankfully, she survived. She's doing well. Granted, she's had her whole life turned upside down. She's had numerous surgeries. But seeing her go through that and, being there when she was at kind of her worst. I remember one year, I think I was like 12 or 13. It was Christmas. And I remember she went into the bathroom because she was feeling sick. And when I walked in, she was just slumped over by the toilet. She had thrown up so much that she had basically become hyponatremic and like having to be the one to call the ambulance and, get help for her. That was definitely a pivotal moment of knowing this is extremely serious. And, I'm an older sibling. I knew that I had to be strong. My dad being in the military, he still had to go off on trips and stuff like that. So I knew I kind of had to take over in the house a bit. So that was, I think, a big maturing point in my life, seeing her go through that and, knowing the deeper implications of what it meant for her, but also what it meant for me as, her daughter, but an older sibling.
That's a remarkable story. So how do you think that has guided, affected, directed your desire to pursue medicine, or has it?
So I definitely think it has, but not in ways I initially suspected. In high school, I thought I really wanted to go into geology and environmental science. And, I worked through my first 2 years of college studying that. And to me, it wasn't, as exciting as I thought. And I remember actually one of my biology professors who taught me basically everything I know today about plants. She was actually diagnosed with breast cancer too. And that kind of brought up a lot of emotion for me because I knew, what that could mean for her. And breast cancer to me has always meant kind of worst case scenario, because that's what happened with my mom. And that was around the time that I wanted to go back into medicine. So just kind of having that going on in my life. I went to a small school. She was a professor I saw nearly every day. Just getting that memory kind of fresh in my mind, I thought, what does it mean to be a healer? What does it mean to be somebody who can do something? I guess like as her student, seeing her lose her hair too, I was like, I can't do anything. But, going into medicine, I'm like, maybe I can. So yeah, having that pushed me along.
That's a great story. Having watched having lost both my parents, and my father quite acutely with a heart attack, and then my mother with the thing I described a little earlier. And I think we all reach it inside to find that thing that keeps us coming back. Personally, number one, I really enjoy the technical challenge of how much information there is to stay on top of. And number two, medicine is the most social thing I do. I'm an old man that goes home to my apartment and watches reruns of Law and Order. And I love going to work. I hope to make 50 years, in the next few years. Enough about me. So not to cast a dark spell here, but what if you don't get in? What are you going to do?
So obviously I want to reapply. I actually just accepted and started a position at UT Southwestern working in a lab. We're doing basically research on tumor suppressor genes, kind of tying back into the cancer narrative. It's in the pediatric department, and we are looking at retinoblastoma in children. And so my plan going forward, continue working in this lab. I've started and I really like it so far. So, if med school doesn't pan out for this cycle, I'm going to just keep doing what I am currently doing, but continue to apply and, reevaluate any sort of gaps or, weaker aspects of my application and see what I can address in the meantime and what I can improve to make myself a better applicant.
Oh, yeah. So do you have real interest in UT Southwestern? And if so, tell me about it.
So I think being, in Texas the past year, I've really kind of fallen in love with Dallas, and having worked at UT Southwestern in the past, I do kind of feel like a sense of attachment. It's where I go to my doctor's appointments. I really love how UT Southwestern is kind of just this like massive conglomerate of basically everything related to human health and also science, all the science behind it. You drive down Inwood and you'll see like on the billboards, number one in insert, phrase here.
There are a lot of number ones here, I have to say.
There are, and a lot of billboards. But I think that UT Southwestern does combine a lot of the really technical science aspects with the patient compassion side of medicine. And I think having both of those things come together is kind of what medicine is all about for me, or specifically becoming a doctor, having the truly deep understanding of something, but also the ability to translate your knowledge into something that an everyday person can understand is so important. Taking something truly technical and being able to explain it in a compassionate way to somebody who is there for your care is a very special skill to have.
Interesting, and much appreciated. I feel the same way about the school. We're going to begin to wrap up. Tell me, what do you think are the number one and number two, maybe three issues in medicine in America today? You touched on it a little bit, but can you expand your thoughts a little?
So I think health insurance is actually a really big issue in the United States. We have people who, I feel like a lot of people in the United States have health insurance, myself included. We pay to receive healthcare, but we're still paying, exorbitant amounts for hospital stays and for just standard doctor's visits. It's almost like, what is the point of insurance if we're still going to be paying crazy amounts of money whenever we go to the hospital for any sort of emergency? And I don't think an emergency should basically break somebody's bank. And I've seen that happen too, patients getting a bill and, you know, they're in the hospital for a broken foot and they're out of work. So they're basically like, how am I going to pay this? I can't go to work. I can't pay this bill off. So I think having a healthcare system that, you know, doctors and, you know, medical staff in general who see these patients and can be an advocate for these patients towards, you know, insurance policies, companies, you know, governmental institutions that can kind of direct these policies, having healthcare professionals be an advocate for the patient who can't necessarily advocate for themselves is definitely a way to kind of bridge the gap of, you know, the financial accessibility of healthcare. And I also think one big issue that's, I guess, kind of hot in the news right now is abortion, and just seeing how divided the US is on, you know, abortion access and the laws behind it. And that's where I think being a doctor, I can educate, you know, people who don't know about abortion and make their own decisions that are necessarily not based in facts. I think having everybody have the facts behind, you know, whatever controversial medical issue is in the news, being someone who can educate people on that and kind of have people meet in the middle so we're not so divided is also another way to kind of fill in those gaps.
That's so well said. You know, there's so many issues facing medicine in this country today. I saw in the news today that there was a small town south of Dallas that actually has said, we're going to have free medical care for everybody in their town. Now, they talked also about how they're going to pay for it, and that's another story, but I thought that was quite interesting.
Yeah.
Cheyenne, are you out there? Let's surprise her. You got a question for Amelia?
Yes, sir. So I do have one that I was actually thrown in my personal interviews that I was like, wow, that's interesting. If you could be any animal, what would you be?
Oh, an animal. You know, part of me wants to say a house cat because I see my own and I see the life that they live and it's wonderful. But I also kind of think a monkey in a way. You know, seeing monkeys do such human things. I know it's so close to humans, so I feel like I'm basically saying I would be a human if I could be an animal. But seeing them do things that are so close to humans, like learning sign language, I guess not monkeys, but apes. Seeing an animal, you know, work things out and do things in a very humanistic way is really interesting, but also having those, like, you know, true animalistic nature, whatever that may be. I just think they're such an interesting animal, and, you know, they seem to live a pretty cool life.
You know, Cheyenne, my answer to that is that would be a sloth so I could sleep all the time.
I love it. I love that answer.
Kiana, you got a question for her?
Sure thing. Hi. How would your friends describe you?
I would say creative. I like to DIY stuff a lot. I feel like all the stuff in my house is stuff that I've just kind of thrown together and put up on my wall and try to make it look good. I'm kind of always trying to find new ways to address the problems that I have or the problems that my friends are having. And so being a creative person by nature, I mean, I love to paint, I love to draw. It gives me a lot of ways to think about the problems that I face, kind of thinking outside the box. It's kind of one thing that I pride myself on in my life is my ability to explore alternatives in whatever I have at hand.
And Ali, do you have a question?
Yeah, I definitely do have one. So I remember we were talking a little bit earlier about some of the problems facing medicine today. How would you like to see medicine evolve in the 21st century?
I would definitely like to see more tech involved in medicine. I think that the strides that we're making to not only, improve in, surgical aspects or imaging, but just the technology that we have that can make the patient experience so much more comfortable. I know the hospital I worked at, we used iPads that had a program where you could dial up a translator who worked anywhere in the world and speak with a patient and translate for the care team. That was crazy. I mean, we had patients coming in who spoke a very specific dialect of Haitian Creole, and we were having such a tough time understanding what she was trying to say. She had no idea what we were trying to say, but having this iPad that could find somebody to talk to her and just make her so much more at ease, having that kind of third party there, having something like that in place, not only to help us, but to help the patients is so important and great going forward.
Yeah. So as we're about to wrap up, do you have any questions for me here at UT Southwestern?
I guess I would like to know, so you're an emergency medicine physician. I guess I would like to know, are there ways that you at UT Southwestern explore outside of your department? What are some of your, I guess, physician or just general staff interactions with the rest of UT Southwestern as a whole?
Yeah, starting with outside UT, I'm an EMS doc. I'm the chief of the EMS division. We have the third largest EMS system in the nation, behind only New York and Los Angeles, here in North Texas, with Dallas and Fort Worth. And so we have a marvelous, huge opportunity to affect the public health. I co-chair the Heart Attack Network for American Heart, which is all of our chest pain patients in the entirety of North Texas. Wonderful group that we pulled together. And then I found, finally, back to UT, I have found a marvelous collegiality, the ability of people to communicate. If I need to send a patient, no problem. It just works and flows so well. So I think the school that's evolved here over the last 70 or so years is one that's really about service to patients, which is something near and dear to my heart. How about one last question, or do you have one?
I know it wasn't in my specific session, but as a physician, as a leader, how do you deal with burnout? I know I've definitely seen it on my end, in the nursing field specifically, but how as a leader do you handle not only necessarily your own burnout, but seeing it happen amongst the people you're working with?
That's a great question. Let me first say I'm very blessed that we have great staff, great nurses, techs, and resident students, and so forth, and fellow faculty. So for me, it's a social, interactive experience, intellectual, but interpersonal as well. The second thing is that I really enjoy the complexity of the patients at Parkland. Some of them are sick. I worked this weekend and I had some sick people this weekend. The third thing is that I find one of the things that pushes any kind of burnout back is intellectual stimulation from the work that you do, and so that you really find it interesting. Then there's some little things. I go to work early. I bring chips for the people. I make sure I finish my charts before I go home, so that's not lingering over my head. I actually do them as I go during my shift. And so I take an active hand in trying to prevent the things that kind of annoy me and fatigue me and wear me out. Some cases are quite difficult. Some people are quite difficult to love, being screamed at by some raving maniac on meth. But it's important not to internalize that, but realize the fact it's part of medicine, and that's what we signed on for. Well, Amelia, what a great interview. Thoroughly enjoyed it, and I want to congratulate you on what all you had to say, and we certainly hope that your path finds its way to UT Southwestern. So thank you so much.
Wonderful. Thanks so much for taking the time to meet with me.
Thank you. Kiana, do you have some questions from the group? Well, let me start first. And Ben, you're out there. I have a couple of little notes. You know that you tend to end your sentences in an up thing like this? You ever notice that?
Upbeat.
I don't know
Yeah.
that that's right or wrong. You also, you pop a few uhs into your sentences. I generally find that is kind of a brain fart. It's sort of a moment where mouth is engaged and brain is not. And so they're neither right nor wrong. You never know if that'll irritate somebody or not. I just noticed that. You had great eye contact. Your room is great. You were very amiable, very businesslike, and yet amiable at the same time. You had a great answer to the biggest need in medicine. And I thought the story of your mother was very moving. My goodness. You also had a really good answer following on from your mother about why medicine. And I liked your answer about what you'll do if you don't get in. You know, that's a very personal thing because that's more time in the saddle, you know, maybe some post-bac work or a master's. The need to make great grades, you know, after that is so very, very important. And as far as the issues that you brought up, I thought that you handled those about health insurance. God, I so agree. I thought you handled the abortion thing very well. You know, that could be a polarizing question, but the way you brought it in, the fact that there needs to be the information to get out so that people can make their own decisions. And I thought you handled the interjection of Ali and Cheyenne and Kiana just fine. Ben, any questions? I mean, any thoughts, Robert?
No, I thought that Amelia did very well, but again, on the issue of the abortion questions, that is a loaded issue. Now, unless you're really passionate about it, yes, bring it up. But on stuff like that, I would tend to be on the conservative side. You know, if they bring it up, then yes, tell them. But I wouldn't necessarily volunteer something like that because you never know what the person sitting across from you viewpoint may or may not be. Again, that's just my thought. I'm conservative in nature.
Great. Kiana, got 2 or 3 questions for Amelia or comments?
Sure. So, Amelia, from your interview, some things that stood out to me was that you answered the questions with enthusiasm, you were genuine, and you had very well thought out answers. But just remember to, it's very hard to, as I'm saying right now, it can be a kind of weird way to transition, but just try to be more mindful. And the best way to do that is through practice. And I need to practice myself.
Thank you.
Anything else, Kiana? Anything from the working group?
I thought Amelia did great. It felt like I was watching cable news. It was like very, very like well thought out. Everything. Your answers are great, and I really don't have anything to say negative. So great job.
Anything else from the working group?
Thank you.
One thing I would
Yeah,
say-
sure.
Good.
Rohit, do you want to go ahead?
Yeah,
Sure.
Ali first.
Oh, you want me to go first? Okay. So a couple of things. First, I think you did very well. I thought
Thank you.
your eye contact and the way you were speaking in a more conversational tone was great because it felt like we were really getting to know each other well, which is good. Your story about your mother and breast cancer, it hit me in the heart because it kind of made me feel about how I got into medicine with my dad and his congestive heart failure and that naivety that you have as a kid, not knowing what's going to happen to your parent and you thinking
Right.
that everything's going to be all right, but it might not. That really did hit me. So it was really nice to hear about that and see why people get into medicine like that. A couple of things that I have to say about your interview. The thing that got a lot of people were ums. For me, it was I feel like you said a lot of was a lot. And the way that it just maybe just a me thing. But when I hear people say it's like, well, I don't. Can you please explain to me what you're trying to say?
Right.
I think it's because this was like an interview that you didn't really have that much time to prepare for. But once you get to know your questions more and you get to write them down and you practice them more and more, those are like ticks that are going to get away really easily.
Mm-hmm.
Another thing was I felt like your first explanation was a little bit long, and I thought it might have been like a thing that you would continue on for the rest of the interview, but you didn't. You caught up pretty well, and you were able to explain everything with a good amount of time and a good amount of I guess, verbatim. Like
Mhm.
I'm trying to find words as well. See, it's hard for you to do it out of the top of your head. But yeah, otherwise pretty good. A couple of things that you can fix, but I feel like with a lot of experience, you nail it and knock it out of the park.
Thank you. It's great to hear that feedback.
And Rohit, last comment.
All right. To be honest, Ollie kind of covered my main point, which is the. One other thing is, this has sort of already been said, but you started some of your answers with like right after Dr. Fowler asked a question, you said, well, this is what I think. So just like take that out. Otherwise, I think you did a really good job. The content of your answers were solid, and I really like that.
Thank you.
So thank you, Amelia, and appreciate Miguel and Ricardo. What a great session. And so, Kiana, I'm going to go back to our slides here. I'm going to try to go back to them. Let's see. Give me 1 second. I won't go back to them just yet. Give me a moment. I have to find it. There it is. All right. Now let me try to go back to it. There it is. So I'm sorry. Let's see. Let me stop. I'm so sorry, everybody. Let me get back to the thing that I'm supposed to have up on my screen. I got it right here now. All right, we got a couple of ending slides and then we'll be done. I won't even project it. Let's just do this. Well, I can project it. Let's see, slideshow. Okay, so sorry, please forgive. So want to thank everybody tonight. That was just great. That took courage. We would have been petrified. Practice, of course, makes you better. Think about that Zoom idea I had where you get everything all set up, find a bud who is applying to the same school, come up with 10 questions, and then record yourself. I think that's kind of a cool idea. And stay in touch. Let us know how things went. There are folks that are waitlisted at colleges of your dreams, and some even offer a semester abroad as the way in. There are a lot of ways to skin the cat. The chat we did already. Kiana, you want to put this there?
Sure thing. So as we wrap up, I would like everyone to please send just thanking our wonderful volunteers today. They all did such a great job, and we're so thankful for all of them. So here is our QR code for assessment 100. It will be due next Tuesday, the 24th by 6:59 p.m. And then you must have a pass 70% or higher. Any closing thoughts, Dr. Fowler?
Well, what a great session. This was marvelous, and it was great to have Dr. Wynn with us to, chat about his thoughts. He's so experienced in admissions. This is our 100th session. We cannot believe that we have been going this long, but we're going to keep going. If you'll keep coming back, we're going to keep doing this. We got a couple of months already laid out. There's some terrific talks coming, and I got an ongoing list of some great invitees that'll continue to give you exposure to the breadth of the wide world of clinical medicine. So on behalf of our wonderful volunteers tonight, thank you so much for doing this. On behalf of the sweetest people in the world that I know, which is the Working Group for Virtual Shadowing, we want to thank you so much for coming, and we wish you a good evening and a good night.